My name is Caleb Dunn, and today we're going to talk about Cushing syndrome. And what we'll do is we'll talk about some of the pathologies associated with it, some of the complications that may happen, and we'll talk about physical therapy, the way that they can help to address the symptoms of Cushing syndrome. So we'll go ahead and get started with the pathology of it. And this will occur when the body is going to be exposed to high levels of cortisol over a long period of time. And this is caused by use of medication, or the pituitary gland can make a hormone known as adrenocorticotropic hormone, or ACTH, and that might be an excessive buildup of that. And this hormone is going to be used to stimulate the adrenal glands, and it's going to cause them to make too much cortisol. That's kind of how that happens. ACTH producing tumors can also happen in different places, and this is going to be known as ectopic tumors, and we'll cover that a little bit more later. Some of the characteristic features include a rounded moon-shaped face, and you'll have thin arms and legs, but you'll have a larger trunk area. So the body might be bigger, but your arms and legs are going to be relatively thin with this. Some of the procedures they can do to determine the cause of this is a low-dose dexamethasone suppression test, or LDDST. And what's going to happen is you'll take a low dose of dexamethasone, mostly around 11 o'clock at night, and then a healthcare professional will come in about 8 o'clock in the morning, and they'll take a little bit of blood from you. Now, normally cortisol levels in the blood will drop when you take this dexamethasone, and if it doesn't happen, then this will suggest Cushing syndrome as a result of this. There are other tests that you can do, such as blood tests, used to measure ACTH in the blood. If the levels are low, the cause of this syndrome is going to be as a result of adrenal tumor. And if the ACTH levels are high, then that's going to be the result of either a pituitary tumor or an ectopic tumor. So high-dose dexamethasone suppression tests, if it's going to be a pituitary or a ectopic tumor cause, they'll use this test, and this is the same thing as the low-dose dexamethasone suppression test, but it's going to use a higher dose of dexamethasone. So if the cortisol levels in the blood drop after taking the dexamethasone, this is going to indicate a pituitary tumor, and if the levels don't drop, then it's an ectopic tumor, and the tumor causing this cortisol buildup is somewhere else. So some of the lifespan changes that occur as a result of this, 90% of all cases of Cushing syndrome occur during adulthood, with only 10% occurring during childhood. Peak incidence of this disease occurs around 25 to 40 years old, and non-medication related Cushing syndrome usually occurs more in women than men, with an average onset at 20 to 40 years old, but there are some cases that have been seen as high as 60 years old. The prognosis of this is going to depend on the cause of the Cushing syndrome and the ability to control the excess cortisol. If the patient decides to leave this untreated, the disease is going to get worse, and it's actually going to affect the patient's overall health. This can cause high blood pressure and possible diabetes in the patient, which can lead to strokes or heart attacks. And there are more rare adrenocortical carcinomas that are associated with a 5-year survival rate of 30% or less. So the prognosis of that is not that great, but the good news is that most of Cushing syndrome can be cured. And there are many individuals with Cushing syndrome that show significant improvements with treatment, but some patients may find treatment complicated by various aspects of this illness. Some of the medical treatments that you can use to help with Cushing syndrome include surgery, such as an adrenalectomy, which is basically removing one or both of the adrenal glands from the body. These are approximately 80% successful, with a 25% recurrence rate after 5 years, and patients will need lifelong glucocorticoid replacement if they have this surgery. And there are medications that are used to control the excessive production of cortisol, such as Nizoral and Lizodrin, and Korlym is actually used for people that have a glucose intolerance or have type 2 diabetes, and they also have Cushing syndrome. If surgery cannot completely remove a pituitary gloomer, or they're not a suitable candidate for surgery, the doctor may prescribe radiation therapy to be used, and this can also be used with the surgery, or this may be also used for patients that aren't suitable candidates. So some of the impairments of Cushing syndrome include protein tissue wasting, potassium depletion, hypertension, and mental changes. And the functional limitations as a result of this, they may have difficulty concentrating, having difficulty remembering things, or they may be unable to go out and socialize with their friends and family as a result of this muscle wasting. They may be too weak to be able to go out and have fun with their friends and family, and this could lead to depression in the patient. The physical therapy for it, the main thing that I found is you can set up an exercise program for the patient. This is going to help maintain muscle mass and bone mass, and this is going to help prevent weight gain. So weight-bearing exercises such as step-ups, push-ups, and weight shifting in parallel bars is particularly helpful for this patient. And you can also prescribe aerobic exercise, and this will help increase the heart rate and endurance of the patient. So you can also prescribe patient education as well to help them avoid falls. Because they have osteoporosis, they're at an increased risk of bone fractures. And so you can educate them to avoid falls and removing rugs or other falling hazards from their home to decrease the likelihood of this happening. And they also have an increased risk of infection, so you can also use education to assist the patient with proper cleaning and wound healing, as too much cortisol can slow down this wound healing process in the body. Some of the implications that are associated with this, they have an increased risk of developing a venous blood clot. And what will happen is if the physical therapist assists the patient in the treatment and the blood clot dislodges, it can break loose and it'll travel back to the heart and it'll lodge itself in the pulmonary artery, which is where the heart is delivering blood to the lungs. And this is known as a pulmonary embolism, which can be lethal to the patient. Leg massage and exercise for the legs by physical therapists can actually help, and this will try to help prevent this from happening. So what will affect the treatment goals in a physical therapy session? The big thing is protein tissue wasting. This can lead to a difficulty developing muscle strength due to muscle wasting. And the musculoskeletal system can also be affected by the onset of osteoporosis and this increased risk of bone fractures associated with falls. So if the patient develops a wound as well, it'll take more time for the wound to heal, and they may be at an increased risk for infection compared to patients without Cushing syndrome, and they may be unaware that they are having an infection. And third effect of treatment goals in a physical therapy session is high blood pressure, and this can also lead to cardiovascular diseases such as heart failure and ischemic heart disease. So the big takeaway from all of this is that most cases of Cushing syndrome occur during adulthood, and if patients decide to lead this untreated, the disease can get worse and affect the overall health of the patient, so it's important to encourage the patient to treat this disease, and prescribing an exercise program and educating the patient on avoiding falls and taking better care of their body and proper cleaning and checking for infection. This can actually benefit the patient and help the patient recover to decrease the symptoms of Cushing syndrome. And that is all. Thank you for watching.